Last night at dinner, Maria Katori went around the room and asked people, "Why are you here?" She didn't call upon me, but I would like to spend the time allotted to explain why I am here. I'll give you a little bit of background to start. I was born in June of 1945 in Tokyo. Now, for many of you, you may think of Japan as a very modern, advanced country, but the Japan I grew up in was a developing world, very much a developing world. And I had friends, 3 friends, childhood friends, who died in childhood. That does not happen in the developed world. It was a world in which you could not eat ice cream because if you ate ice cream and you could get it, you would get diarrhea and perhaps die. Well, that sort of experience made me want to consider a career in medicine at a very young age. I had a grandfather who was a physician, and the thought that I could have helped my friends who passed away early made me truly committed to the thought of becoming a physician. So I did, in fact, pursue such a career. I left Japan at 15 and came to the United States and went to medical school, expecting to be a physician, but I learned very quickly when I began to see patients that to be a good physician, one must first be a good scientist. And so I spent the first part of my career being a biomedical scientist, and then eventually I was asked to assume more administrative positions involving teaching, and I enjoyed that quite a bit because I felt that I could influence more patients as a teacher and as a scientist. I also wrote a textbook, and that was directed at hopefully training more people so that they could treat more patients. And when the opportunity came to consider a career in the pharmaceutical industry, the thought that I could participate in the making of new medicines that could affect thousands, if not millions of people, was irresistible to me, and I joined the pharmaceutical industry. I ran research and development in a pharmaceutical company, and very shortly after I became the head of research and development at GlaxoSmithKline, the company became engaged in a very, very unfortunate lawsuit. And this was a lawsuit in which the company sued the government of South Africa because they wanted to lower the price of medicines for HIV. Now, you might imagine the world's response to that. It was deserved. In fact, the world's response to this apparent act of greed created a sense of shame for the industry and perhaps did much to reduce the reputation of the industry. But it was a pivotal moment in my life and for many others in the company that I work for, when we began to think about what was important. How does one succeed in a world in which there is such great disparity? It is not possible to succeed as a company, no matter how rich one could be, if one didn't address the issues of the developing world. So for me personally, it was a journey. We created a unit for diseases of the developing world, specifically focused on malaria. We had a very robust vaccines program in a variety of areas, including malaria and TB and HIV and rotavirus and human papillomavirus and other diseases that influence the developing world. And we formed a very important partnership with the Bill and Melinda Gates Foundation in many of these endeavors in what would be called public-private partnerships. So when, in fact, my predecessor, Rick Klausner, left the foundation last September, I was very worried about the programs that we had in collaboration with the Gates Foundation. And I came to the Gates Foundation last November to discuss how we would continue our programs. And the answer I got was, why don't you come and join the foundation? So, well, of course, I was thrilled to meet people like Bill Gates Sr., Patty Stonecipher, Bill and Melinda Gates. But the thought that recurred in my mind was an image that came from my training as a house officer, resident in internal medicine. And I don't know if many of you are physicians in the audience, but if you are, you will remember the patients that you could not help better than the patients you could help. And I had this vivid image of working in the emergency room and seeing a young woman come into the emergency room with a baby clutched in her arms. And when we could remove her hands from the baby, we found the baby was dead. It was such a vivid, poignant moment for me that I forgot it. It was so painful, I literally forgot it. But in discussions with the Gateses and the Gates Foundation, that image came back. Because here is the nature of the problem. 10 million babies die every year. 10 million. That is unbelievable. 4 million die in the first month of life. 90% of it from preventable causes. 1 million from malaria. Why has that happened? Well, to one extent, it's happened because of success. Because much of the world has dealt with these issues, and therefore it's not a concern to them. And, in fact, our medical education spends almost no time on these issues. I myself trained many physicians, and I never thought about these problems as my own. But it is clear that this is a world in which these problems will create instability unless they're corrected. Aside from the moral issues involved in such disparity, the world cannot be sustained in an environment of such inequity. The industry, the pharmaceutical industry, has really not addressed these issues. 1,500 drugs have been developed in the past 30 years and approved and registered for use by patients. Of this 1,500, only 20 have been focused primarily on diseases of the developing world. In this environment, one has to remember that health is the first step. Addressing health disparity will allow the beginning of addressing economic disparity, and economic disparity, once corrected, can create stability all over the world. Why is this a great time for us in this environment? Why can we have a sense of optimism? The reality of it is there's a huge interest in global health now in a way that there was never before. Many of you in this room are here with an interest in global health. I gave medical grand rounds at the University of Washington 3 months ago, and I met with the 7 chief residents from the Department of Internal Medicine. 4 told me they were going to go into global health. They told me that in the primary care residency program at the University of Washington, fully 85% of the residents have expressed an interest in global health. Companies that I talk to ask how they can participate, how they can give. Many individuals of high wealth have focused a lot of attention on what they can do for global health. It's a wonderful time. And what we have are clear, known successes. We have eradicated smallpox. We have almost eradicated polio. There have been incredible programs to eradicate river blindness and lymphatic filariasis and guinea worm. And these are application of existing approaches to treating problems which are severe and suffered by millions, and they have been successful. We have also developed successful approaches, models for dealing with health. There's a global alliance for vaccines and immunizations. Started 6 years ago, actually started before, but fully funded 6 years ago. And hundreds of millions of dollars from nations all over the world have gone into this. And as a result, 13 million children have gotten vaccines, just routine vaccines. 90 million children have gotten a hepatitis vaccine. 14 million children have been vaccinated against Haemophilus influenza B and yellow fever. This is a very successful model. And above all, the pipeline is rich. We have made good investments in science, and we're making more. And these investments in science, in malaria alone, now there are 20 pharmaceuticals, drugs in the pipeline for malaria. Never there before. There are 9 new vaccines for malaria in development. The investment in science has created a great pipeline. So this is a time for great optimism. But there are huge challenges. First of all, there are many skeptics out there. They're saying, you throw this money around, but you're not going to do any good. Show me that you're actually doing something. Often you read claims that we vaccinated so many people and therefore we saved so many lives. Have we counted any of those lives? Can we quantitate? Do we have information? Can we prove that what we have done works? That is the challenge. We can only convert the skeptics with hard facts, true knowledge, real information, real results. That is the challenge. We also have a challenge that we're going to fail often. I have been part of the pharmaceutical industry. 90%, 99% of what we do in that industry fails. And we're going to fail. We will have many experiments. We will invest in many scientific technologies. We will try many experiments, and most of them will fail. But if we invest enough, we will create a pipeline, and a pipeline, if rich, will allow some successes. So that brings me to the next and perhaps most important challenge, which is the challenge that we have to prepare for success. What does that mean? So we have a drug. How do we get it to the people who need it? We have to, first of all, have an information base to understand what the existing conditions are, truly understand them. Create an intervention that will alter that circumstance. Have a cadre of leaders in science and medicine who can interpret that information in the countries, because they are the ones who will then convince the policymakers. The policymakers, once they establish a policy, now have to have a cadre of soldiers, of health workers, not necessarily physicians or nurses, but people who know how to implement healthcare solutions so that ultimately those solutions can be brought to the patients. This is the time now. Now we have the tools, we have the interest, we have the excitement, we have the money, we have the hubris to believe we can do something if we commit to it, if we join together in an effort, in an organized way, to address problems that must be addressed for the world to be a safe place. That's why I'm here.